Hey everyone, today I want to dive into a critical topic that impacts millions around the globe: depression. Did you know that depression is a leading cause of disability worldwide? It's true, with nearly 10% of adults in the United States affected, yet it's still often misunderstood. Let's break it down. First off, let's distinguish between feeling sad and experiencing clinical depression. It's completely normal to feel down occasionally due to life events, but clinical depression is different. It's a medical disorder that lasts at least 2 weeks and significantly impacts your daily life, whether that's at work, play, or in your relationships. So what are the symptoms? According to psychiatric guidelines, having 5 or more of the following qualifies for a diagnosis: low mood, loss of interest in activities you once enjoyed, changes in appetite, feelings of worthlessness or guilt, sleep disturbances, poor concentration, restlessness or slowed energy, and recurrent thoughts of suicide. If you or someone you know is experiencing these symptoms, it's important to seek help. Depression isn't just a state of mind, it has physical effects on the brain. Research shows that people with depression often have smaller frontal lobes and hippocampal volumes. There's also abnormal neurotransmitter transmission involving serotonin, norepinephrine, and dopamine. And let's not forget about hormone abnormalities like elevated cortisol levels and thyroid issues. Now, what causes depression? While the exact cause is still unknown, it seems to be a complex interplay of genetic and environmental factors. Unfortunately, there's no diagnostic tool that can accurately predict who will develop depression. When it comes to seeking help, the average person with a mental illness waits over 10 years. That's way too long. Effective treatments are available, including medication and therapy, which often work best together. There are also options like electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS. If you want to support someone with depression, encourage them to seek help gently. Offer practical assistance like helping them find a therapist or making a list of questions for their doctor. And remember, don't compare their experience to temporary sadness. Open conversations about mental illness reduce stigma and make a big difference. Alright, that's it for today's video. If you found this information helpful, please give it a thumbs up and subscribe for more. Take care, and remember, help is available.